Our didactic for today, which, if you'll recall, is the second of a two-part series on behavioral interventions for hallucinations. And I actually changed things up a little bit last time, where typically when I do this two-part didactic, the first part is on both skills training and behavioral activation, and the second part is on exposure. But last time I did just behavioral activation for voices because it is an extremely, well, it's both underutilized, and oftentimes it's one of those interventions that seems like it's very easy to do, but is a much heavier lift when we actually try to get the person activated in a way that's going to address their psychotic symptoms or reduce their distress from the psychotic symptoms. And so just to remind you, we're really looking at addressing what are the things for this individual that makes them more vulnerable to experience psychosis. And those are really the first of the 3 Ps. But in a practical sense, it's really the perpetuating factors, right? It's the things that they're engaged in right now that are either maintaining the psychosis or making the psychosis worse. And the second point of intervention are what are the things that they're doing after the symptoms occur. And this is also under the category of perpetuating symptoms. What are the maladaptive behaviors after the symptoms have already onset that are actually making things worse? Things like yelling at the voices, complying with the voices, unchecked cognitive distortions, increasing isolative behavior. And so those are the 2 things that we're going to target. And almost as a rule, it is the rule rather than the exception that our clients that experience psychotic symptoms tend to have a lot of avoidant behavior. And the most powerful, we know that avoidance maintains anxiety. And we know that the most powerful antidote to anxiety is exposures. And the premise here is very simple. Avoidance prolongs fear, and that's via negative reinforcement. So when we avoid the thing that makes us anxious, in the immediate term, it reduces our anxiety. And that then makes us more likely to avoid that thing in the future. And so exposure can help extinguish someone's fear by teaching them a couple of things. One is this sort of meta lesson of not fearing fear, that I can experience the emotion of fear and I won't die from it. Nothing catastrophic will happen to me or to my family. And then to increase the likelihood that they learn to more accurately assess whether the catastrophized outcome will occur. So when I avoid things, I don't give myself a chance to learn whether I needed to avoid that thing in order to stay safe. When I confront that thing, I give my brain the opportunity to learn whether I was in fact in danger or not. So exposure can be we can think of it quite broadly. Typically, we're thinking about exposure in terms of situations because exposure is most commonly used to treat specific phobias, or PTSD. But exposure can be to other things as well. So if we think about it in the context of psychosis, exposure can be to the voices calling me a bad names, or simply just hearing the voices themselves, because many people try so hard, they restructure their entire lives just to avoid having the experience of hearing the voices. It can be to emotions, and most commonly the exposure that we're looking for in psychosis and an anxiety disorder is to the emotion of fear or the experience of anxiety. It could be to thoughts like the voices will never go away, and that's an example of a flooding exposure. Another example that's used in insomnia treatment is the thought, I'm never going to fall asleep, I'm never going to fall asleep, and really just taking some of the energy away from that thought by exposing yourself over and over to it. It can also be to behaviors. So we could engage in behaviors that we think will have some bad outcomes. And here's when we do exposure to behaviors, that's oftentimes where we see a very kind of fuzzy line between, is this an exposure or is this a behavioral experiment? And in some ways it's kind of splitting hairs, so I wouldn't get obsessive about it. But typically the purpose of an exposure is simply to bring the emotion that goes alongside whatever you're exposing yourself to down naturally. And maybe also have an opportunity to learn that the feared thing will not happen. With a behavioral experiment, we're often targeting a specific thought or specific prediction about the future. So that's kind of one way to differentiate. And I will often draw or show a graph like this to my clients when I'm trying to provide the rationale for exposure. I'll talk about how when we confront something that makes us very anxious, that our anxiety will shoot up like a rocket. And I'll use a self-disclosing example of a fear of heights or a roller coaster ride. And then I'll talk about how when our anxiety is that high, it's so uncomfortable that the natural urge for anybody on this planet is to escape that situation that's driving the discomfort. And when we escape, our anxiety comes down usually pretty quickly, and it will usually come back down to around the point where it was before we entered into that situation. If we actually don't leave the situation, though, if I were to stay on that bridge, if I were to stay on that roller coaster and let it go over and over and over again, the decline of our anxiety would be slower, but it too would still get back down to the point where it was before we were in that situation. And then the next time we do it, what we'll notice, from what most people notice, is that their anxiety doesn't get quite as high, and then it comes down a little bit faster. And so the point is here to do this thing that you feared many, many, many times, so that the anxiety is less intense each time and it comes down more quickly each time. And so we can do this for exposure to voices or exposure to particular things associated with the voices. So I talked about that roller coaster analogy. It is so important that we're doing a good orientation to the principles of exposure and why we do exposure and why it's helpful. So in addition to that roller coaster analogy, the other example that I like to give is if you have a wound, if you have a nasty gash, then you know that to suture that gash is going to hurt quite a bit. It's going to be a lot of pain all at once, potentially, as they're suturing you, but that over time, it's going to heal better, and that pain is going to diminish over time. If we avoid that gash because we're worried about the pain, it's actually going to hurt for much longer. It's going to be less likely to heal, and we're actually more prone to having other problems as a result of that open wound. And so the same thing is true for anxiety. Anxiety tends to get worse if it's untreated, but the good news here is that we have really good treatment for anxiety, and that it is this exposure, and we can do it in a way that is safe and comfortable. And so one important reminder is that emotions can be incredibly uncomfortable, and fear especially can be an incredibly uncomfortable emotion, but it's not dangerous, and they can learn to tolerate fear and to not run away from it. And that's kind of what we'll do together. There are 4 conditions to make exposures effective. One is graded. Now, that's not a condition as in you need to have that. You can certainly do an all-at-once exposure called flooding, but it tends to be really aversive for clients, and so it's not one that we recommend, particularly in this population where we know engagement can be really tenuous. So we want to provide people the assurance that we're going to do this low and slow at a pace that they feel comfortable with. And you will create that, kind of hierarchy together so that they really feel control over this process. The second condition is that we're doing prolonged exposures. There's no set time here, right? So it's not like we're going to set this artificially and say, you're going to listen to the voices, or you're going to listen to me impersonating the voices for 30 minutes. It really is as long as it takes for the anxiety to reduce by 50%. Now, what you can do early on, as you're just kind of doing that low and slow, is you can say, what is amount of time that you would feel comfortable with listening to me saying the things that the voices say? And if they say 30 seconds, then that's where you start, and you've got an agreed upon amount of time, even though you know that their SUD rating might not get down by 50%. That's okay. The other number that's often used is, instead of reducing by 50%, some people will say that the SUD rating should be below a 40%. So either one of those is perfectly acceptable. What you're going for here is just that they're not leaving an exposure while their anxiety is still feels distressing or unmanageable. The third is repeated. So you want to repeat the same exposure until that anxiety at the start is at a more manageable level, thinking like a 40% or maybe even a 50% at the highest. But if you think back to that chart on that last page, every subsequent exposure, they should be starting off at a lower level. And it might take a few times for you to get to that, which is where the combination of in-session exposure plus home exposure comes in. And in order to get somebody to do an exposure independently or at home, they need to be in like 100%. They really need to have internalized why you're doing this, so that they don't. That brings us to our fourth one. We don't want them to use distraction. We don't want them to be going through the motions, but not really allowing themselves to get their fear up to the level where it would naturally be without the distraction. It is okay to use coping skills at first to get through the exposure, but then we would like for them to try it without the coping skills. So for those of you who remember the in-person training, there was a video where you saw Doug Turkington doing an exposure with a client named Helen, and they talked about looking at somebody in the office, looking that person in the eyes, but while she was doing that, she was going to be thinking of a pretty dress. And so that's perfectly fine to get her through. It's the first time. Make sure that you're taking those away over time, because that brings us to our next topic, which is reducing safety behaviors. And safety behaviors are any time that somebody is engaging in a behavior that they believe helps keep them safe. So if I believe putting on my right shoe before my left means that I will not die that day, or wearing a hat to prevent people from stealing my thoughts. We all do this. These are very normal things. We all have our safety behaviors. But in order to really effectively do an exposure, we need to know what somebody's safety behaviors are, and we need to convince them to give them up, because otherwise they're not truly testing out whether the feared consequence will occur. And they're also there. It's a natural. It naturally is bringing down their anxiety level because they've done this thing which keeps them safe in their minds, right? So we have to, again, educate the client. So this is just a worksheet. You can find it online on psychologytools.com. It's free. It explains what safety behaviors are, what catastrophic thinking is, and what types of safety behaviors there are. And what's really nice about this is that it talks about the 3 types of safety behaviors that we almost always see in individuals with psychosis, which are different forms of avoidance. So not going into the feared situation is pure avoidance. Subtle avoidance are the things that we do in our minds, like distraction or undoing behavior, undoing kinds of thoughts. And then escape, which is you leave the feared situation. I also found, Oh, then the second part of that worksheet is what are the effects of safety behaviors? And this is really, this is too many words in my opinion for a good worksheet. So it might be worthwhile for you to kind of talk this through, like get yourself really familiar with this worksheet, talk them through it, and then you can just take it one example at a time. And it's always, always, always an effective technique to do these examples that are not about the client, right? This is somebody else. The early experience that somebody had in their life was that they were humiliated at school about their appearance. They developed the belief that if people see my armpits, they will think I am disgusting and reject me. Their safety behavior is to keep their arms at their sides at all times. And then you talk about what does that behavior do for them in the short term? What does that behavior do for them in the long run? And what are some of the unintended consequences of that behavior? Okay, this is just part of that worksheet on psychologytools.com is just an interaction between Homer and Lisa, where Homer has developed a kind of some magical thinking, right, around the rock keeping him safe, and Lisa's trying to dispute it. And it kind of asks some Socratic style questioning to get the client to think through, to identify it as a safety behavior and to think through how he would challenge that safety behavior. And of course, the answer is exposure. Okay, so let's do an example. So Johnny experiences voices telling him to stay home or he will die. You've engaged in cognitive restructuring on the belief that the voice will hurt Johnny if he doesn't follow its commands, with good success in a new, more adaptive belief. So his new belief is the voice says it will kill me, but it never has. However, Johnny continues to feel distress when he hears the voice threatening him, even though he can remind himself of his new adaptive belief. So in this case, he may find it helpful to engage in imaginal exposure, just kind of confronting this voice in his mind, and in vivo exposure, which is in real life. So here's what it might look like for imaginal. And I say what it might look like because one of the things I love about CBT is just how creative you get to be and how collaborative it is. So this is one of a multitude of possibilities of how this could have looked. Imagine the voice, so he imagines the voice telling him to do something. He imagines himself not engaging in this behavior, and he takes an assertive stance. His hands are on his hips, his chest is puffed out, his voice is calm and confident as he delivers his restructured thought and successfully resists engaging in this behavior. This is a really popular technique in a form of narrative therapy where they do a lot of imaginal rescripting. And then an in vivo exposure might be to try to elicit the command voice in session. When the voice gives the command, the client calmly and confidently listens to the voice and rehearses the new response. Another way that you could do this is that Johnny tells you exactly what the voice says, and then you play the role of the voice. And you would ask questions like, what does the voice sound like? What's the pitch of the voice? Does the voice have an accent? You really want to try to get it as close to the voice as possible. And I'm just going to stop sharing. Oh, I have one more. So before I stop sharing, let me tell you this. At the CBTP International Conference, there was a presentation on avatar therapy for voices, and they actually showed some video footage of the avatar therapy where the voices, it's an interaction. There were two types actually. There was one where the person is doing exposure to feared situations like getting on the bus. There was another one where it was much more relational. So this is Toni Morrison's work, is a lot of kind of who in that person's life do the voices represent, and what's that dynamic between them. And if you can repair that dynamic, then they're going to be less distressed by the voices, and the voices might actually diminish in frequency as well. And so they had this audio it was real audio from a therapist who was using, it wasn't quite avatar because it wasn't visual, but you could hear the voice. And the voice was saying, was bullying them. And the client was essentially standing up and saying, well, it's not true that I'm worthless. I went to the store today. I took care of what I needed to take care of. And the voice says, well, I still think you're worthless. I still think, you could be stronger. And the person, over and over again is rehearsing their adaptive response. And eventually the voice starts to concede and say, really repairing things like, I just wanted you to be strong. I was just trying to make you strong. That's why I would say those things. So here's an example of a graded exposure. Again, this would be collaboratively developed with your client. You would start with an imaginary exposure. You would have, the second might be that the client is the commanding voice and then you're responding. Then you play the voice and the client is responding, and you kind of up the ante each time in terms of what the voice is saying and how distressing that is for the individual.